aggregate cases of coronavirus in Victoria since the beginning of the pandemic. That's just 12 new cases since my report yesterday. 8 of those 12 cases are linked to known outbreaks, and 5 of those are under investigation by our public health team. 7 cases were reclassified. They relate to, in the main, historical cases that go back, I think the breakdown is 5 in July, 1 in August, 1 in September. I am sad to have to update you that there are now 773 Victorians who've lost their life due to this global pandemic. That's 2 since my last update, and they are 2 females in their 80s. We, of course, send our sympathies and condolences to those 2 families, and I can confirm that both of those deaths are linked to aged care. There are 67 Victorians in hospital. 8 of those are in intensive care, and 6 of those 8 are on a ventilator. A total of 2,622,822 tests have been taken since the beginning of the pandemic, and we have received 13,337 results since yesterday. That's a strong number, another strong number in terms of the number of people that are going and getting tested, and I thank each and every one of them. It's a really important thing that you can do. Even the mildest symptoms, please get tested. Please go to one of the more than 200 testing sites across the state. You'll get your result within 24 hours. I would ask that even mild symptoms, as soon as you register those symptoms, please go and get a test. Don't delay a day. Don't wait till the end of the week. Please go and get those tests today. That's really very, very important. It gives us the most complete picture, the most accurate picture, so that we can understand what the virus is doing, and so we can get it each day closer and closer to that COVID normal. But again, thank you so much to those more than 13,000 people who got tested, and their results were received yesterday. Total unknown source cases, 4,267. That's a decrease of 1 since yesterday's report. There are 83 healthcare workers who are active cases. We wish them well, and we thank them and all of their colleagues for the amazing work that they do. There are now just 532 total active cases across the state. The metro regional split, there are now 10 active cases in regional local government areas under the 3rd step restrictions. In terms of rolling average to the 23rd of September, the metro rolling average is 26.7 and the regional average is 1.1. In terms of active cases in disability facility settings, unchanged at 4. All of those are staff. Aged care active cases, there are 274 cases that are still active. In further thanks to our dedicated health workforce, particularly our hospital workforce who have gone into aged care, I can confirm that there have now been 4,718 shifts that have been worked by hospital staff in private aged care. And that's a mighty effort and amazing achievement, and we're very grateful to each and every one of those staff. Just before I make a couple of general comments about the numbers and where we find ourselves, I just wanted to pause for a moment and on behalf of all Victorians send our love and support, our condolences and our best wishes to the family of William Wall. This is a terrible tragedy and one that I think has touched every single Victorian, and I know that this will be a terrible time for that family. And to every member of William's family, we say how sad we are and that we share in your grief and your loss, and any support that we can provide to you, we of course stand ready to do that. This has touched, I think, the hearts of every single Victorian. Can I also make a comment about how proud I am to think that emergency services, volunteers, career, members of the community all did an amazing job. They did their very best. And sadly that's not the outcome that they or any of us wanted, but I did want to pay tribute to them. Whenever they're called upon, they always step up, and it does make you very, very proud. In general terms, 12 cases is another very good day. These numbers are coming down. This strategy is working. We are well on track on Sunday to make some further announcements, and I just wanted to make the point that Sunday will not be a day of massive steps. It will not be, the roadmap does not speak to that. It is not a day when we essentially throw the doors open. It will be, however, steady and safe steps, and that sense of gradual, continual progress is what we are able to do because we have a gradual and continued decline in these numbers. At 12 cases, or at an average just under 30, that's still too much for us to take big steps. We've got to be safe, we've got to be steady, we have to be cautious, otherwise those new settings simply won't last. But today should be a day where Victorians are positive, to have another day of lower case numbers. The trend is with us, the strategy is working, and I am very proud and very grateful to every single Victorian, which is the vast, vast majority of people who are out there doing the right thing. That's making a big difference. These numbers don't come down by accident, they come down because of the hard work and the absolute determination of Victorians to follow the rules, to play their part, to come forward and get tested, even if they've got a very, very mild symptoms. All of that amounts to a strategy that's working, a strategy that will get us to that COVID normal, and the way we'll get there will mean that we'll be able to stay there, and we won't be bouncing in and out of lockdowns during 2021. I now might ask Luke just to speak to, in the scheme of things, a relatively modest amount of money, but one that can provide really significant support to those who are doing it tough across our Victorian community. I, of course, refer to the notion of food relief funding and the work that part of our charitable, philanthropic community sector, our not-for-profit sector, does. It's an amazing effort. So many people being provided with the very basics, the things that really are critically important for them and their family. And today we have some further announcements to make about grants and support for them, so that they in turn can support those who are, without question, the most vulnerable in our Victorian community. So I'll now hand over to Luke.
Thank you, Premier. Today is very much a recognition of the announcement is very much a recognition of the difficulties people are going through in relation to this coronavirus pandemic. So it's an $11.3 million announcement with these various components to it. The first component is $2.3 million, which will fund about 7,500 packages for those who are isolating, those who may not have community contacts in relation to a coronavirus. So that'll, as I was saying, that'll fund an extra 7,500 packages. We've already put out 5,500 packages for those who need to isolate. So that will cover the extra 7,500. We've also put $5 million together for grants of up to $75,000 for community support organisations who are already out there in the streets providing food to those people in the community in great need. Now, these funds could be used for developing further volunteers, because obviously we know during this period of time many community service organisations have not been able to have the same numbers of volunteers assisting. That might be for equipment, it might be for new distribution methodologies, but it's very much about increasing the capacity of those existing community service organisations out in the community to actually provide food relief and support to the community. Separate component is the regional food hubs. So this is a $3.5 million package, and it's very much focused on getting up to an extra 5 food hubs in Victoria to distribute food, to collect food, to warehouse food. So we're looking at up to 5, as I was saying, in the regions of Loddon Mallee, Barwon South West and the North East region. So we're looking to partner with existing organisations who are providing food relief in those areas, but to very much provide them with the capacity to act as a hub in the regions to actually ensure they can receive and then distribute food. So that's very much what those regional food hubs are about. That is separate from the hubs we've already committed to, which was a $10 million commitment to establish food hubs through Food Bank in Morwell and Ballarat, to again distribute food, to store food, and to provide very much needed help to those people on the ground. And then separately, food relief sits between various levels of government. So we're setting up a task force to actually, I guess, get timely information of what's going across the whole of the state. So whether it be we'll have local government, we'll have logistics experts, we'll have existing providers, so that we know where there are gaps in terms of need in the community, so that we actually have timely information. So we're not actually guessing at what's going on. We've got a timely feedback loop to ensure we know where there are needs in the community and how we can actually meet them. So if there's gaps, it might be, for argument's sake, ethno-specific food, we can identify that early. If we've got problems in certain communities in terms of food provision, we'll get on top of it a lot quicker. So this is very much about trying to put together, I guess, intelligence in the sector. And I know that sounds something difficult to grasp, but in other words, we've got the federal government, we've got the state government and local government all involved in food relief. I very much want to try and bring that together so we actually know what's going on a daily basis, and we can ensure we meet the needs of the community who need food relief in these very difficult times. Thank you.
Good, we're happy to take any questions you have.
Premier, does your Health Minister lack basic competence and understanding of her portfolio?
No.
Are you concerned at all that it appears now that two ministers have no idea about really critical decisions that were being made by their departments?
What I'm concerned to do, Alex, is to allow the process that I've established to run its course. And as you know, that isn't concluded yet. And when it is concluded, there'll be a report, there'll be findings. That's entirely a matter for that process to determine those matters. And once we're furnished with that, then we'll be able to have a more detailed discussion.
What does ministerial responsibility mean to you, and are you confident that your ministers are taking proper responsibility for their portfolios?
I am. All ministers are fully aware that the accountability for those matters that go on within your portfolio, that's a well understood concept, and I'm very confident that everyone in the government fully understands that.
How much value do you place on the health workers' union's call that they have lost confidence in the minister?
Well, they are entitled to a view. They've put that view in fairly colourful terms. What I'd be more focused on, and what I'm happy to commit today, the Chief Medical Officer, Chief Health Officer, others meet regularly, as I understand it, weekly in fact, with all health unions, because it's a very important part of their job. The Minister attends not necessarily every one of those meetings, but has attended many of those meetings. If there's any issues that that group or any group in the community, and particularly in the health sector, want addressed, then we're more than happy to sit down and work through those issues. We've done that as a feature of the pandemic.
Do you have confidence in the Health Minister's ability to continue in that portfolio?
I have confidence in all my ministers, otherwise they wouldn't be my ministers.
Are you concerned that the union that represents thousands of the lowest paid health workers, people who work in aged care, some of the workers who you've stood up and shown your support for most days of this pandemic, is calling for your health minister to resign?
Well, I'm very supportive of that workforce, not just in words, might I say, Rachel, but in good faith bargaining, some election commitments we made specifically for that workforce, whether it be providing some of those workers with some career advancement opportunities where they wanted to go and play different roles within the health system. I have had the great fortune in my public life of meeting many members, not just of the clinical community, but those who support them. And I'm sure you've heard me say on many occasions that health services are delivered by teams of people, and every member of that team, regardless of the role they play, is a very important part of that team. I've got nothing but respect for those workers. Others can form different views about some of these matters. My position is very clear. If there's an issue that needs raising, if there's an issue that needs to be talked about and resolved, then I'm happy to confirm for you that there's a regular process. All health unions are engaged in that, and that's exactly as it should be. If there's any specific issues that need raising, that need to be addressed, then I'm very confident that the officials I've mentioned, and indeed many more, are focused on those things, and they've not as a function of me saying it from this podium. They've been focused on those issues for months and months and months.
Will you be disappointed if we get to the end of the inquiry into hotel quarantine without finding out who is responsible for key decisions?
Look, I think it's very difficult for me to be predicting what the outcome might be, and by necessity, the question which you're entitled to ask really calls for me to predict what the outcome will be, and that process is not finished. And I will wait, and I would ask that we all wait to see that final report.
Has there been any evidence presented so far that's come as a surprise to you?
Look, Lundy, I'm appearing tomorrow, and I don't think it's appropriate for me to be providing a narrative. There'll be a time for me to do that, and I will do so in my typically clear and frank way, but I don't think that's appropriate to do that now. The evidence must first be considered by the inquiry, and they must draw whatever conclusions they believe are appropriate, and me being a commentator on that evidence I don't think is helpful or, in my judgment, appropriate. What I would say though, clearly mistakes have been made in this program. There's no denying that. That's why the inquiry's been set up, and I think we should allow the inquiry to do its work rather than presupposing where they will or won't get to.
Victorians want to know whose idea hotel quarantine was. So far, the inquiry hasn't answered that question. Do you expect to answer that question tomorrow?
My only expectation tomorrow is to answer all the questions that are put to me. That's what I'll do. As to what I'm asked, that's not a matter for me. That'll be a matter for council assisting.
Is that a question you're able to answer? Do you know the answer to that question?
Well, I will provide answers to any and all questions that are asked of me tomorrow by the inquiry.
But that's a simple question. Can you at least tell us whether or not you can answer it? Do you have that information?
Well,
Do you know
Rachel,
that?
I'm not here to answer questions that the inquiry will put to me. They're matters by their very nature. They're matters that the inquiry may or may not put to me. And to be honest, it's not even, I think, appropriate for me to speculate on what they may or may not answer, lest that be seen as me inviting them to cover certain material or not. That is entirely a matter for them, and they will construct and determine what they ask and the manner in which they ask it. That's the nature of an inquiry of this kind.
Premier, we've now seen the Prime Minister's letters to you in July. He wrote 3 times in the space of days offering ADF support. Why do you think he was so urgent in offering that?
Look, everything about this pandemic is urgent. The requests in July the letters in July follow requests that I made in June, and a regular correspondence, whether it be by phone, by messages,
The difference was
or
this time
indeed
the Prime
letters.
Minister was personally
Sorry?
writing to you. The difference here was the Prime Minister was personally writing to you a number of times in a space of days. Why were you reluctant to receive ADF support?
Well, you see, that's the conclusion that you've drawn, and I don't think you can fairly draw that conclusion. I made requests in June, and indeed earlier than that. I've made many, many requests, and I'm pleased to say that they've all been answered. And that's why we've got, I think at my last briefing, we've got more than 1,000 ADF troops on the ground here now, doing an amazing job. So I think it is both inaccurate and unfair for you to infer from those letters or anything that's occurred any reticence on my part.
How can you say that that is inaccurate or unfair when we've heard time and time again that people in your ministry have forgotten, they don't remember if the ADF was offered? Had the Health Minister say it, Police Minister, Chief Health Officer, the list goes on. No one seems to remember it. So how is it fair that you would say...
I'm not entirely sure what you're referring to by virtue of...
The fact that the ADF was offered support?
We're talking about July. We're talking about July.
We're talking about in general whether the ADF was...
Well, whether
put
you're
to
making
you
a
as an
well, hang on.
option.
Whether you're making, let me be really clear with you. Whether you're making whether you're inferring in general or specific terms reticence, that's simply not accurate. That is not my view. That is not my position. And if it were my position, specifically or broadly, then we'd hardly have 1,000 ADF, and we've had up to, I think, 1,500, something like that, doing all manner of work. And I think if in relation to the letters I'm asked about, I think I've already taken, I don't have the documents in front of me, but I think I've already taken all of you at some length to the breakdown of those, and I think you've been taken to that most recently. So I don't think those comments are accurate. We're very grateful, and all requests that have been made have been based on need, and they've been responded to. And I've spoken with Commodore Hill on a number of occasions. I may have to speak to him again about different things. It's a very positive relationship and partnership.
Well, let's go more specifically then. June 24, Andrew Crisp requested ADF support. The next day, that was then rescinded down to only a couple of hundred. The Prime Minister just a week later, started their series of letters offering more support, which one would assume you were reluctant to take the fact that he kept offering this.
No, I don't think you can assume that at all. There are many different letters that come. There are many different... They're not the only letters the Prime Minister's written me, nor I him. Plus phone calls, plus messages, plus meetings. And I'm not quite sure how many National Cabinet meetings we've had across the journey, but many. I'm in regular contact. My ministers are in regular contact with their counterparts. My officials are in regular contact, so I wouldn't draw that inference at all.
So why did Andrew Crisp then rescind that request the following
Well, I think
day?
he's gone directly to that matter in the process that I've just referred to. I've already answered that question from this podium, and I don't propose to add to that answer.
So did you accept the offer of ADF support from the first letter that the PM sent you?
Oh, look, I'd need to check. These things are letters come in. They usually follow requests that
Three
have
in a
been.
row, though.
Well, again, I think you're drawing conclusions, and you're free to do that. But that freedom doesn't mean that you are right, and I'm indicating to you that you are wrong.
What is the testing rate?
Much, and I think that's pretty consistent with the fact that I took you all through these matters when I made the requests in June, which is before the letters, and the troops have arrived and they're doing a great job, and we're deeply grateful to them. It's nothing more or less than that.
You yourself have been a health minister. Would you have applied the same arm's length approach that Ms McCarkos has apparently taken in this pandemic?
I have been a health minister. That is correct. I think the second part of your question is not an accurate reflection of the work that the minister has done.
That she's not aware of key decisions that were made by her department?
Well, I wouldn't agree with the way you've characterised the work that she does. Yes, I have been a health minister, and I don't think.
Would you have taken the same approach?
Sorry?
Would you have taken the same approach?
Well, I don't need to draw comparisons. You can draw those if you choose to, but it's a very challenging job. It's a very, very challenging job at any time, and I think that every member of the team is doing the very best that they can. I'm not going to stand here and do comparisons between my time as health minister and the current time, because in some respects you can't compare them. That's the nature of a 1 in 100 year event. Be rather self-serving too, I would have thought. Well, I'm not really into that.
What is the current testing rate in regional Victoria, and are you happy with it?
Sure. We are happy that there's an adequate number of tests to get against well understood benchmarks, World Health Organisation benchmarks and others. Alan yesterday spoke to 1 in 100, 2 in 100, and in some metropolitan communities where there's more virus, therefore more symptoms, up towards 3 in 100. If you would like that to be a feature to the extent that it isn't, of the CHO release that comes out later today, I'm more than happy to pass that on.
Are you concerned about a sense of complacency creeping into regional Victoria, given numbers are low there? Are you concerned testing rates might drop?
I'm not concerned about that, but your question is a very good question, and it gives me an opportunity just to remind, in the most positive of terms, there are different rules in regional Victoria, but doesn't mean there's no rules. There are rules, and they need to be followed. We all need to stay the course on this, and it should be, and I think it is a point of real pride in regional Victoria that they've been able to drive these numbers down to such a low level. The aim now is to keep them there, and one way that you can do that, regardless of whether you live in the smallest country town or a big regional city, is to keep following those rules, to wear your mask, to wash your hands, to never ever go to work if you've got symptoms. The only thing to do if you've got symptoms is to get tested, and to get tested as soon as possible. All of those common sense things, as well as, if I can speak for a moment, to business owners who I think by and large are doing a really good job of being as COVID safe as they can, but that's something that has to be constantly monitored, and I think that businesses are very much committed to doing that.
With Sunday's slight relaxation, are you looking at more personal freedoms, or just on that businesses thing, are you having briefings with some businesses because they might be affected by these?
Both. But it is very clear that the roadmap, as we announced a few weeks ago, contemplates a much bigger step at the end of October, and it's never been the case that we felt that it likely that we could take those sorts of steps essentially a month early. We're still working through the finer details of that, and we'll make those announcements. Again, all things being equal, we're well and truly within that band. In fact, we're bettering that. But whether that means we can fundamentally change, I think that's most unlikely. But we're looking at other things we might be able to do. But I just wanted to be very clear with people that their expectation should be of small, safe and steady steps as part of Sunday. But the strategy is working, and people can be confident that the trend is with us, and we'll have under constant review what was scheduled in October and the timing of that. So Sunday is a pretty hard date, but there may be some other options that, not right now, but they may become available to us if these numbers continue to fall the way that they have.
Are you giving consideration to lifting the curfew, given how contentious it's been, and I guess how significant?
I would simply say this: I'm not here today to make any announcements about that matter. and there are matters on foot at the moment, so I really wouldn't want to be drawn on those.
Can you rule out any change to the curfew?
No, I can simply say to you that I'm not here to make any announcements today. As I stand here today, there are no announcements to be made about that matter. It remains in place, and it will remain in place as we've outlined.
How much further ahead are we today than what your modelling showed? What were cases supposed to be around this time?
I can't give you an exact case number, and modelling is being rerun and retested as we speak to inform those decisions that we'll have to make on Saturday evening. I don't think Sunday morning. I think they'll be settled by the evening of Saturday, but it'll probably be a late night. We are ahead of schedule. Just how much we're ahead of schedule, and indeed how meaningful that is, it's almost. I think I've at least tried to make this point a few times. You might be ahead of schedule, but does it hold? That's the key point. Does the trend continue? And the challenge in a point in time measurement is obviously the days and weeks that come after it are even more important than the position that you've arrived at. That's why 14-day averages are important, but they're a rolling average. So our performance each day, and then trends that come out of that are very important. But the trend is with us. This strategy is working. We can be confident and positive about that. I think we are ahead of schedule, but whether that holds and whether we've been ahead of schedule for long enough to be able to change dates further into the roadmap, that's not a decision that we can make now. But I do hope to be able to have a bit more to say about that when I'm here on Sunday.
Do your experts have any idea what particular part of these stage 4 restrictions are having the best effect and which ones perhaps aren't having the same effectiveness?
I wouldn't speak for them, but I can ask for their most contemporary understanding of that and maybe make that a feature of a briefing later on in the week. Maybe something that we can have a conversation about on Sunday. But it is challenging to sort of disaggregate what each of them accounts for. I think you've got, just as we've often said, risk needs to be, you need to get an aggregate picture. So you've heard me talk about aggregate movement, cumulative movement, things of that nature, which is a way of measuring risk or a factor that sits well beyond individual settings, an individual business or an individual activity. Similarly, I think aggregate benefit is a really important context too, and it's sometimes really hard to disaggregate. You know, you're doing 15 or 20 things. What does each of those account for? I think they all have to be seen as a package, and the package, together with the fact that the vast majority of Victorians are absolutely invested in seeing this thing off and doing it properly, that's what's delivering these numbers.
Once the decision's been made on Saturday night, when are the changes expected to come into effect?
That's not been finalised yet, but we'll be quick. We'll be quick about it. So we'll try and make sure that there's the smallest amount of time between when we announce it and when they come into effect.
Does that mean there won't necessarily be a change come Monday?
Oh no, I think that we're probably talking about the difference between midnight Sunday and midnight Monday, and it's difficult to answer because we don't know the exact nature of what's going to be in that package, and some of those things there might need to be some time, and other things can happen midnight Sunday. But once we've determined on what's in that mix, then in that package or in those series of announcements, then we'll be able to give you that answer. But in general terms, we'll be as quick about it as we can be.
Premier Anastasia Palaszczuk has written to the Prime Minister about ADF being taken away from border control. Within it, she says, I understand this is inconsistent with the approach taken with other jurisdictions, including New South Wales and Victoria. Were you aware that Anastasia Palaszczuk was writing to the Prime Minister?
No.
And do you agree with her stance on border controls to use ADF?
The Queensland border is a matter for the Queensland government, and how those arrangements are enforced. They're so far away from the work that I'm doing that, frankly, I don't have time to speculate on that. If she's written to the Prime Minister, I haven't seen the letter. The letter's not addressed to me. I'd leave it to them, the two of them, to sort that out.
And just to confirm, you're completely satisfied with the use of ADF that you've had in Victoria. You don't think you should have gone further at any stage?
Well, no, we've made requests. Those requests have been taken seriously. We've received very significant support. I'm very pleased with the support that we've got. Sorry?
And you've received offers as well, obviously?
Yes, I suppose you could term it that way. But we've asked for help, we've got the help, and we're very pleased about that. And we're very grateful to all of those who have done it. No different to bushfires, no different to when there's a gap, when there's a challenge, when there's a need for everyone to work together. That's exactly what we've done. It's what we always do.
Sole traders
grant applications were supposed to open today, but just looking at the website, it appears they're still not accepting applications. Can you understand there's a degree of frustration from those sole traders who are holding out for this government?
Yes, I can, Lundy, and you're at somewhat of an advantage to me because you've got a device there that confirms for you that that's not open. I will double check for you why that's the case, and if there's anything I can do to hurry that up, I will.
Are you open to the consideration of off-peak fares for public transport?
Yeah, I saw some reports about that today, Alex. We'll have a look at that. We're looking at all manner of different things. Obviously, road network's going to look different. Patterns of movement, transport, all of those things. Therefore, public transport will look different, not just because of consumer preference, which I think will be an issue, but also distancing requirements wherever they land at the appropriate time. I'm not necessarily agreeing with that specific proposal, but we'll certainly look at it because we are in the process of looking at lots of different things.
The number of active cases in health workers is increased by 10 since yesterday. I think we've gone from 73 to 83. How concerned are you about that? And I guess how much of a problem are those stubborn numbers in health and aged care where the restrictions aren't necessarily going to have any impact on them, but they will have an impact on our ability to reopen?
Well, I think that as your question developed, it's health workers, but it is, as you say, health and aged care. So it's really important, and it's public and private. It's right across the board, and it's not even just clinical staff. It can include others who are working in those environments. Look, I think that the best answer to your question is there's a reason why we're not chasing 0 cases every day forever, because we know that there are, as you say, there are some very stubborn settings. They're high risk for a reason. There's a reason why we see more and more of the virus in some of these settings. That's why it's important to do everything we can. I believe we are. That's the. I'm confident that the arrangements we've got in place in those high risk settings, and it's not just clinical environments, it's industrial environments as well, workplaces beyond health, aged care and the like. I'm confident that we've got good, strong plans in there, and we've seen significant improvement. But, for instance, I don't know that this is the case, but you could equally ask me this question in a week, perhaps, where it would be the case. An outbreak in an aged care facility, very well contained, locked down, really good contact tracing. We know all the people who might have been affected. That could be 6 or 7 cases, could be even more than that. And I'm not saying that we would ever settle for that. We're all doing what we can to have 0 cases in aged care, not in the sense of a statewide issue, but because we know how vulnerable the residents are. But this is wildly infectious.
New crime statistics show a 6.7% rise in family violence
Yes.
in the year to July, which is the highest on record with 88,000 crimes. Advocates warned that this would happen and feared that the curfew might exacerbate family violence incidents. What's your response to this, and why is the curfew still in place?
Well, I don't agree with that assessment, the latter one you just put to me. In relation to family violence, increased rates of family violence being a feature of this pandemic, I'm not arguing against that. That is a fact, and that's why we've boosted support, and that's why Minister Williams has been here on a number of different occasions to talk about not just more money, as important as that is, but doing things differently and making sure that services can continue to provide care and support to women and children and any other members of families who might need support, as well as, not that you're ever pleased about any statistics in this area, but one point that I think Gab had made quite eloquently, I think, was the notion that there was a rise in the number of people committing family violence, by and large men, who were coming forward to get that behaviour change support that they need to stop doing that, to not be violent. So there are lots of different trends here. It is a very significant challenge. That's why we've responded as best we can, but we know and understand that there will be more to do throughout this, and indeed on the other side of it. And I would respectfully point you to the fact that I think we're at $2.7+ billion in our time in office. It is more than every other government in this nation combined, but that's still not enough. It's not a boast. It's simply a statement of how big a challenge this is.
How concerned are you about the drop in JobKeeper funding that takes effect from Monday, given Victoria is likely to be, I guess, impacted most by this? Oh,
look, I've had a conversation with the Prime Minister about this matter, and I've made it made it clear to him that, you know, we would always want more support rather than less. But those are matters for him, and he can speak to the changes that are being made. I did ask for slightly different, but not an unrelated matter in relation to business and indeed to a certain extent workers, that hardship payments that we've paid shouldn't be taxed by the Commonwealth, and I'm very confident that that's exactly what will happen. So, you know, we have a positive discussion about the things that we need to talk about, but that doesn't mean we necessarily agree on every matter. But I'm not interested in having a quarrel about it. I don't think that's necessarily productive given where we're at and given how positive this news is. But we always reserve the right to make requests. We always reserve the right to you know, whether it be tomorrow or in a week's time, talk about different support that we think the Victorian community needs. The pleasing thing there is that the Prime Minister has continued, well, he has always maintained, and I don't believe that his position has changed, that hardship would drive all the policy that the federal government were about. The other thing too here is that there is a federal budget quite soon, and whilst the Federal Treasurer has not shared with me the contents of that budget, I think there's a fair bit of commentary in the media about that being a really significant program of investment, and the best thing that I can do, and the best thing I'd argue that we can all do, is to get these numbers down, get business back open, and get people back to work into their job. That's what makes that's the ultimate fix to JobKeeper, I suppose.
Premier, just on that, can you confirm you'll be announcing changes as part of these relaxed restrictions to allow meat processors to have more workers on site?
No, I can't confirm that, but I can certainly confirm that we're in active discussions with them, as well as, so there's a number of industries, if you recall, and if I recall accurately, meat processing, which is obviously across all different streams, supermarkets, because distribution centres have been a really challenging environment for us, cool stores as well, and indeed construction is not at 100% either. So all of those matters are being actively looked at, and when I'm ready to make an announcement about that, I will. But we're certainly talking to all of those players.
Just on meat processing, last time we chatted about this at the start of August when lockdown was announced.
So I remember it well.
It was a very clear understanding between us that September was the tough time for lamb, given the spring lamb flush,
Indeed.
when things needed to get back in business.
Yep.
Given where we are now, surely they've got to be announced.
Absolutely. So the flush, calving, all of these issues, spring's a very challenging time. And sometimes it's for big parts of the industry, sometimes it's for much more targeted parts of the industry. It's an industry I know and understand well. It's an industry we are absolutely engaged with, and we'll be in no doubt. We understand that as we get further into spring, it gets more and more challenging for them to continue to operate at that level, and that's why we're working hard to try and get those levels up, and we're having very detailed discussions with them.
How much notice will they get? Because given how difficult it is to attract and retain staff in that industry
Sure.
to begin with.
They'll get as much notice as we can give them. And I think I went to this not on Meatworks, but I went to this point the other day. I think I made the reference to it in relation to supermarkets. So I had a meeting, must be a couple of weeks ago now, and my office has had many meetings, and other ministers. We've given them a series of options. So they are essentially thinking and planning against each of those options, and they fully appreciate that until we get, you know, the most complete data set, we won't be able to tell them which of those options we're going to be able to approve them for. But I think they're, as best you can, I think they're well advanced in their planning. I know what they want. I'm not for a moment quibbling with that. I know why they want it, and we're working hard to see if we can safely give it to them.
What other industries are you in discussions with?
Oh, we're in discussions with just about every sector, Lundy. Every sector that's got restrictions on, we're talking to them, and we continue to talk to them. And I should say we listen in the main, because it's not just about easing. It's sometimes, quite often, about how the rules relate. Even if they're not coming off for some time, there can be unintended consequences. There can be issues and challenges. So we're in a constant discussion with them.
Are you likely to make any announcements on Sunday about allowing one-on-one inspections of rental properties and homes for sale?
I'd hope to be able to say more about the real estate sector, but I can't do that now because those decisions have not been made.
Premier, just on today's media release
Yes.
and the announcement of the 11.3 million, how much of that is because there are more vulnerable people and people needing to take up those services, and how much of it is because it costs more money to do things in a COVID-safe way?
I think it'll be a mix, but my judgment, and if I'm not correct in this, Luke can jump to the podium and correct me, I think that it will be a mix because some COVID safe practices may mean you can do less with the same resources. The costs, if you like, go up, unit costs. But I think that the overwhelming majority of this money will go to meet greater demand for the services that these amazing groups provide every single day. Now, there's no question that there is greater hardship in the community, and that's why it's appropriate that we support those who are absolutely committed to looking after them, not just in the pandemic, but every single day. I think this is, in the scheme of things, we're often talking about billions of dollars. This is not that, but it's no less important.
Do you have any numbers around how much the demand has increased?
If we have those, we'll most definitely get them to you.
At the beginning of the second lockdown, the estimate was 250,000 Victorians would lose their jobs. Are you aware of whether that was more or less, or whether that was correct?
I've not had any revised modelling put to me, so I can only assume that remains, and to the extent modelling on these sorts of things can be accurate, that remains broadly accurate as to the impact. Of course, there are, as a result of the roadmap, there's about 101,000 people that are or will, if we can take next steps, will go back to work. So that obviously deals with a big, not all, but a big part of that. And of course, some of the other matters we've just been talking about, if we can get the percentage up, then that'll be more people, more shifts, greater output. And we know that particularly from a food point of view, as we go into what is the busiest season every year, that Christmas season, planning now really determines, and output and work now determines what's on the shelves come Christmas time. That's made even more challenging by the fact that Coles, Woolworths, Aldi, Metcash make it very clear to me that yes, it's the busiest time of the year, but they're already operating at Christmas levels now. So it's a challenging thing.
And are you aware of yourself or any of your ministers being contacted by Deborah Glass's office in regards to her investigation into the lockdown of the high-rise towers?
I don't believe I have been. I couldn't speak for other ministers.
Regional Victoria may get to 14 days without a case before Metro Melbourne gets to 14 days fewer than 5 cases. Will that ring of steel still stay up, or do they both have to be on the same setting?
Sorry, let me just who was getting there first? Sorry.
Regional Victoria, yeah.
May get to a lower virus status even further than Metro Melbourne.
If they get there beforehand, how long will it take for the ring of steel to come down? Do they both have to be on the same restrictions?
Sure. The border and its enforcement between Metropolitan Melbourne and Regional Victoria is about maintaining the low virus status in Regional Victoria. It's also, in some respects, a function of the fact that there's only certain reasons that you're allowed to leave your home. There's only certain reasons that you're allowed to travel anywhere. As those restrictions are eased, then logically there'll be more reasons to travel. The challenging part will be to align that with the number of cases that we've got. But for so long, put it to you this way, sorry Henrietta, to be clear, for so long as Melbourne, travel from Melbourne to Regional Victoria poses a risk to Regional Victorian case numbers, then that border will be in place. Not a day longer, but we're not about to do anything that might risk the fact that Regional Victoria is in a much better and a much different place in terms of this virus than metro area. But the metro numbers, the pleasing thing is the metro numbers are coming down as well. They're not as low, but they are coming down, and they will get to the point where we will be able to say, right, we can treat the state as one and people can travel.
Can I just ask one to Luke for our regional friends, please?
Sure.
Health Department's rolled out a call to test service for people who have symptoms of coronavirus and cannot get tested due to injury or mobility. How will this benefit people with a disability who cannot leave the house, and why is it important?
There's actually a capacity to, under I think changes with the NDIS and with Medicare, for them to call and actually have a service to reach in and actually test them in-house.
And do you know how many call to test?
No, look, I couldn't provide you with that figure. No, because a lot of it we run out of the NDIS, so I'm a little bit, I'm reluctant to provide you with a figure, but I know that service is available, and that was one of the changes which was made earlier on during this coronavirus period.
And have you had to scale back any regional services because of the restrictions, I guess, on people working across venue?
There are, in terms of day programs and things like that, have been restricted and so forth. So yes, there's had to be restrictions in terms of people out and about, attending day programs and so forth, yes. And then some services in terms of in-reach services have been restricted for the protection, obviously, of people in residential settings.
And given the state that regional Victoria is in at the moment, when will that change?
Look, that depends. There'll be, in terms of public health advice, in terms of what people can and can't do. Obviously, everybody working in that sector is now required, obviously, to have face masks and so forth when they're working with people face to face. But in terms of when all those services come back, that would be something we're working through with public health at the moment, in terms of things like day programs and the like.
The Health Workers Union covers a lot of the workers that your portfolio covers, aged care workers, disability workers. What did you make of that letter calling for Jenny Mikakos to be sacked?
Well, Jenny's a very hard worker, so I don't agree with that assessment. The Health Workers Union covers the private sector area, and obviously we work with them and we work with stakeholders in that sector, even though it's obviously regulated and managed by the federal government, in terms of restricting worker movement and so forth. So in terms of engagement with Health Workers Union and the sector, we do extensive engagement through DHHS to, I guess, try and minimise that movement, because we really need them to work with us to actually get that mobility reduced in terms of moving facility to facility. For argument's sake, in terms of our public sector, metropolitan aged care workforce, all of them now are into just one site. Each worker only works at one site. So, and in the private sector, there's also been work to ensure the movement has been very much minimised.
Just one more question.
Sure.
for the Premier.
Lundy, just before we do that, on call to test, if the ones we've done, my last update was, it's a while ago now, it was about 1,500, but if we can get you an update on how many, not the ones Luke's talking about, because that's not us, but if we can do the ones where we've gone out and visited someone for whatever reason, we'd be more than happy to provide that. Because simply, well, you asked, but beyond that, I want more people to know about this. If there's someone who has symptoms and wants to get tested, and for whatever reason they're not able to get to a testing site, we'll do everything we can to come to them and to get the swab taken, because that's very, very valuable. Very valuable. Alex.
A press release on April 2 from the government said that the crisis cabinet would be reviewed on September 30th.
Yes.
Is there an intention to extend that?
I think that those arrangements will be extended for a period of time, based on the fact that we're, albeit in the back end of a second wave, but they're there as a result of the unique circumstances we face, and there'll be a time when those arrangements will no longer be fit for purpose, and we'll go back to the normal business of cabinet. There's already been some changes that have been made beyond that in terms of different cabinet working groups, noting the challenge that we face at the moment, particularly in relation to the preparation of the budget and a big plan for investment and confidence and jobs, I suppose would be the best way to term it. Any other issues? If not, any symptoms, please get tested, and please get tested today. See you tomorrow.